Hello everyone and welcome to Edusurg Clinics where we discuss some key topics related to common medical and surgical practice. So from today's topic, you can make out that this is going to be a high voltage discussion, and this is one of the very important topics to know for all the surgeons out there, that is energy sources in surgery. Sadly, this topic is not routinely discussed in our classes, and that is why we have created this series of a few videos where we will discuss the basics of energy sources that we use in surgery. Now, some of our students have often asked that why learn these things? These are physics. This is something that we don't need to understand as a surgeon. But you have to remember that in your operation theater, if you try to manipulate these instruments and then start using them without knowing how they work or what is voltage, what is frequency, and if you switch them on, this is the likely outcome. Either you may get shocked or your patient may get burns or shock due to this improper use of energy sources. So in this first presentation in this series, we are going to see some definitions which are very important to understand. We are going to see the mechanism of action of monopolar and bipolar electrosurgery equipments. And we are going to learn some of the effects that these energy sources have on tissues and a practical application of the routinely used cautery machine in our theater. I'm going to show a pic of that machine and explain each and every setting in that machine. So stay tuned to this video if you want to learn these topics. So first of all, it is very important to understand that we routinely call the entire machine and the entire set as cautery, but that is wrong. Technically, electrocautery is an electrically heated wire which comes in contact with the tissue. So basically, the energy that destroys the tissue is thermal energy and not electrical energy. So there is no transfer of electricity through the patient, and this is a direct current. Basically, batteries are put in a thermal probe, and this probe, with the help of battery or plugged probe, the electricity hits a wire, and this wire is then placed in contact with the tissue, which produce thermal mediated tissue injury. Whereas in electrosurgery, that is the thing that we use in surgery very commonly, current has to pass through the patient to produce desired effects on the tissues. And this is alternating current. This is a very commonly asked multiple choice question, that electrosurgery uses alternating current, which is passing through the tissue. And there are different terms that you may have seen in the operation theater, like cut, coagulate, desiccate, or fulgurate. We are going to see what these terms mean. So coming to electrosurgery, in this talk, we are going to see the two most standard electrosurgery equipments. This is a monopolar electrosurgery and this is a bipolar electrosurgery. The terms are important, monopolar and bipolar. Now let us see why they are called monopolar and bipolar. So here you can see a very rough diagram of a monopolar electrosurgery. This black box is basically the machine, and we are going to see the settings of the machine later in this presentation. But you have to understand that the machine is the source of the electricity. From this source, the electricity travels through this wire into this cautery or active electrode. So technically it is this pen-like thing that we call cautery or bovie in relation to the name of the person who found it. So cautery is the active electrode. Then from this active electrode, see this is a monopolar. So there is only one pole of active electrode. So the patient has to be applied with a patient cautery pad, right? Or a return electrode in technical terms. So basically what this means is that the current that comes from the source, that is transferred to the tissues using the active electrode, the current then transfers in direction of this red arrow up to the cautery pad, and then through the return electrode, the current completes the circuit. So this red area is the area of current travel through the body. So where you apply your cautery pad is very important in different surgeries. For abdominal surgeries, we commonly apply it on the thigh. The cautery pad has to be applied in an area which is devoid of hair. The area should not be wet. It should be applied very well. These are some of the standard points that you are told in your operation theater. So this is the circuit of monopolar electrosurgery. From the source to the active electrode to the tissue transfer to the return electrode, and from return electrode back to the source. Now coming to bipolar electrosurgery, what bipolar means is that both the electrodes are in the device only, right? So one of them transfers the electricity, the other collects the electricity and sends it back to the source. So from the source, the upper arrow is sending the current to the active electrode, and the return electrode is a part of the device only. You can see here how the device looks. One of them is active electrode, the other is the return electrode. And from the return electrode, the current goes back into the source. Why this is important in bipolar? This is because the area of current travel through the body is very minimal. It is only between these two blades that the current travels in the body. So lateral thermal spread, chances of having electrical burns in the patient are less when we use bipolar electrosurgery. Now, both of these have some specific uses, and to understand them, we have to understand this chart. Now, this is a high voltage chart, and to understand this chart, we are going to spend 2 minutes or so, where I am going to point on three key points, right? But before understanding this chart, we need a very quick half a minute physics revision where we need to understand only two words. One is voltage, right? Because these are the settings that you are going to use in that chart, and these are the settings that are there on the machine in the theater. So this is a very important chart. So one important term is voltage, which is the peak amplitude of the current. And the other important term is frequency, which is cycle per second, right? So 1 hertz is 1 cycle per second. 1000 hertz is 1000 cycles per second, or 1 kilohertz is 1000 cycles per second. So these are the two words that you need to understand: amplitude, which is the voltage or the amplitude of the current that you can see in this chart, right? Peak amplitude, and frequency, that is the number of cycles per second, right? So these are the two terms. Now I said three key points. So what is the third key point? The third key point is highlighted in purple. It is the flow of current, right? So whenever you use a cautery setting, you have to understand that there are three key points that are working to produce desired effects on the tissue. If you understand these points, you can use the cautery very well, right? What is this? That a low voltage. What is voltage? I said amplitude. So you can see here, if this is the baseline, this is the amplitude. To the extreme right, if this is the baseline, this is the amplitude, right? So this is low voltage going towards high voltage, right? Frequency. What is frequency? It is number of cycles per second. So here you can see the frequency is very high. Here you can see the frequency is slower, right? So high frequency, low voltage, these two are clear. Now we talk of the flow. You can see here a gap in the flow of the current. This is a gap in the flow of the current, gap in the flow of the current, gap in the flow of the current, right? So voltage, frequency, and flow, right? So when you have a low voltage, high frequency, continuously flowing current, the cautery setting is known as CUT, right? And when you have, on the other hand, the extreme right, high voltage, but very low frequency and highly interrupted flow, the cautery setting is known as COAG. right? So this is how you have to understand this chart. So now we will see some of the commonly used settings in the machine on your operation theater, and we will see actual peak of a machine that we use in the operation theater, and we will see what settings are commonly utilized by surgeons in the OT. So like I said, high frequency, low voltage and continuous flow, that is this chart, is known as a CUT, right? CUT setting on your machine. Continuous flow means that the current is 100% on, right? Now going to blend one, it is 50% current on, 50% current off. The voltage is slightly higher, the frequency is slightly lower. Coming to blend 2, it is 40% the current flowing and 60% the current not flowing. That is how the cycle is designed. Going to blend 3, the gap or the interruption increases. And finally, the COAG, which is a very commonly used monopolar setting. The flow of the current is very high voltage, but it is very low frequency and it is a highly interrupted flow. You can see that the 94% of the cycle is off current, only 6% is on current. We will see in upcoming slide that commonly seen settings are CUT, blend 1 and COAG, and blend 1 is known by a blend term in the commonly used machine. So I hope this chart is clear now. 3 points that you have to remember: voltage, frequency, and flow. So now we will see the machine. I am sure you would have seen these colors in your operation theater. This is the standard machine that most of the OTs have, right? You have a bipolar setting. You have two cords that you can place in the bipolar, the CUT and the COAG. These two are monopolar settings. This blue one is the bipolar setting. So first, for bipolar setting, you can have three options, that is precise, standard and macro. The light shows that commonly used setting is standard. Standard in voltage is 320 kilohertz, and that is what all of us use. We use standard setting in bipolar, and we will see why standard setting in bipolar is used when we see the crest factor, right? So as far as this part of the machine is clear, the most commonly utilized setting is standard at 320 kilohertz, and usual setting for the power is 40 to 50, right? Now coming to the second part, that is the monopolar CUT setting, you can see that there are three options: low, pure, and blend, right? Low versus pure is more or less the same. The difference is in the voltage, the frequency. I told CUT is high frequency, low voltage. So the frequency is around 390 kilohertz, and low and pure are fully continuous, like 100% on systems. Coming to blend, like I discussed in the chart before, it is blend 1. So the cycle is 50% on, 50% off. The frequency is the same, 390 kilohertz. The frequency is the same, that is 390 kilohertz. Now, before going to the COAG setting, you will see some new terms, that is desiccate, fulgurate, and spray, right? These terms we have not discussed. So just for technical sake, let us see what these terms mean. Commonly in the COAG setting, we use fulgurate or spray. Okay, if you have assisted some cholecystectomies laparoscopically or open, you would see that the spray setting is used for performing hemostasis on the liver bed after removing the gallbladder. Very commonly used site for spray. Another commonly used site for spray is retroperitoneum. We will see why the spray mode is used in these areas, what is unique about this spray mode. But before that, just a few definitions. Desiccation means that the tissues are destroyed by dehydration. But if you continue applying the current after desiccation, it can cause a lot of lateral thermal spread, and this is one of the causes of complications in surgery. Fulguration is a non-contact effect. We will see contact and non-contact in the next slide. but it is basically effect that goes from coagulation to carbonization. That is, you can see that the tissue start becoming black if you apply cautery for a very long time. That is basically fulguration, like coagulation to carbonization, depending on duration of current applied. Vaporization, all of you have seen that when cautery is used, you can see the vapors happening. That is vaporization. It is initial desiccation followed by intracellular boiling followed by cell explosion, which leads to vaporization. So like I said, there are two ways in which the electrosurgery can be used. One is a non-contact mode. So suppose this red line is the tissue. The cautery does not touch the tissue. Okay, it is around 1 to 2 mm away from the tissue. This is known as a non-contact mode. This is very important to understand that non-contact mode helps you in cut and fulguration. You have seen that these terms are present in monopolar cautery. So these modes apply to monopolar electrosurgery. Non-contact mode helps you in cutting without carbonization, and non-contact mode for the right duration helps you in fulguration, which helps in hemostasis. On the other hand, contact mode means that you touch the cautery to the tissue. You can see the black arrow touching the tissue in the second image. This is the mode that is to be used for coagulation and desiccation. I would again like to highlight that these modes are for monopolar cautery. The bipolar has only one setting, that is standard, right? So revising our machine again, like I said, the bipolar we use standard. In monopolar cut, now you know that it is a non-contact mode, right? We saw in the previous slide that monopolar cut is a non-contact mode, and the commonly used modes are pure and blend. We have seen the monopolar coagulation is a contact mode, whereas monopolar fulguration is a non-contact mode, right? Now coming to the last part, that is monopolar coagulation. You remember from our main key point chart that coagulation, the cycles are on for less than 10% of the time. So desiccation, the cycle is 8% and 240 kilohertz is the frequency. For fulguration, the frequency is high, but the cycle is operational for a very short time. Coming to spray mode, the cycle is active even for a smaller time, right? So the spray mode and fulgurate mode differ only from the kilohertz cycle point of view, right? Both of them have the same frequency. And this is what helps us differentiate the coagulating power of different modes of cautery, right? So what is crest factor? Crest factor is the ability of a particular setting in the machine to coagulate without cutting. Okay. The higher the crest factor, the higher is the ability of that setting to coagulate but not cut. Okay. So if we see bipolar and monopolar cut, of course it's cut. The ability of coagulation without cutting is low. It is 1.5, right? So monopolar cut setting should not be used for coagulation, right? Similarly, bipolar has to be used for coagulation, but with extreme care and experience. Okay. The usual coagulating modes are the monopolar fulgurate, which has a crest factor of around 7.5. And that is why most people use a cautery setting of blend and fulgurate or pure and fulgurate, right? And the spray cautery has the highest crest factor of 8. And that is why this spray cautery is liberally used routinely by many surgeons after laparoscopic cholecystectomy or in the retroperitoneum to cause coagulation, because we know that it will not cut the tissue unless used totally irrationally, right? So that is why this spray mode is often used for diffuse hemostasis. So now coming to some technical points before ending this video. A very important point for all surgeons to understand is that your table should not look like this, right? You can't have wires that are completely jumbled up. In current surgery, a lot of technical devices are used. We will see some of them in upcoming videos in this energy sources series. But you have to understand that all the wires have to be placed very meticulously so that when you need those devices, you don't struggle. And that can reduce your anxiety in the OT, that can reduce temper related issues in OT if you get all your devices properly. Some other points are use the lowest setting as feasible. If you can achieve your tissue resection at 25, you should not use 50, right? Very important is to understand that pacemaker, defibrillator, and conductive prosthesis are all devices that can conduct current and that can be affected by current. And that is why monopolar electrosurgery use needs to be minimized when these devices are present, because the current that passes through the tissues can lead to harmful effects. Important point while using monopolar and bipolar electrosurgery is to clean the tip to avoid eschar formation. Because when the eschar accumulates on the tip of the electrosurgery, it increases the resistance to current and it can lead to spark and flames. So in this presentation, we have seen application of monopolar electrosurgery, bipolar electrosurgery, the typical theater machine that we use and the settings on that machine and what they mean. We have seen the terms like contact and non-contact modes of monopolar electrosurgery. And we have seen terms like fulguration and spray and how their crest factor helps you in selecting different modes when hemostasis is required. So in the upcoming presentations, we will see different energy sources like ligashore, harmonic, thunderbeat. I am sure you would have heard these exotic names. We will decipher each of them and we will make sure that we understand the devices that we use so as to avoid complications due to devices. Thank you.